You're probably wondering why I'm actually holding an orange. Well, we're going to talk about how to perform surgery, and the most important thing to understand are there are 5 steps that you have to know. So what are the 5 steps for you to actually learn how to do surgery? If you have a procedure, you must understand what the indication is. Why are you performing the procedure before performing it? And once you understand the indication, you can basically filter which patient it actually addresses and why the procedure is being performed. And from there, we're going to go to the details of how to perform it. And the next one that you have to understand is the anatomy. What are the relevant structures that are going to be in the vicinity of the organ that you're going to be working on, either removing or fixing? You have to understand the relationship of structures because those structures are endangered of you actually causing damage while you're performing the surgery. They may be affected, and so prevention is key in order to avoid those issues. After you understand the anatomy, then you go to the steps. There are going to be major steps of the procedure, and this includes a detailed part after you start it, whether you do minimally invasive or open procedure, and they're going to be the key aspects of the procedure which are going to be the most important aspects. After you've understand the steps, then you go to the important details of performing it, which includes exposure and visualization. You can't operate if you can't see. And exposure is a combination of seeing what you're going to operate on and actually retraction. These are important key aspects for you to be able to perform the surgery safely and with good control. Once you've actually gotten good exposure, visualization, and retraction, then you can proceed with dissection. And those are the key aspects, and that's why I have an orange here, is actually to help you understand tissue planes, which separates one layer from another. We just don't cut into people or their organs. We actually separate them safely. Let's take a look. So, if we are working at exposure and visualization, something that is underrated is positioning. If you're working up in towards the upper abdomen, most of the time it's very important to position the patient with head up. If you're working in the pelvis, you want a patient positioned head down. And this could be in supine or lithotomy. And other things could be right side up, left side up. On top of this one, if you're doing the procedure open, proper placement of retractors is important because you need to be able to put all the other organs which are not necessary in the field away and retract the abdominal wall. Here, we're actually going to start with cutting the orange. And what this will actually show you are different layers, and you could call it the anatomy of the orange. And so when we cut it, we're cutting the skin of the orange. From there, you could see it going down pretty well. And one important aspect when you're cutting something is you want to cut it long enough so that you're able to retract it. And so if I've cut it this long, and notice if I'm trying to peel the skin, it doesn't provide enough retraction. And so by cutting it longer, extending your incision, will you be able to get a better exposure and visualization. And so now I'm going to retract better. And so you could see inside the orange. And so from there, let's actually explore. And we're going to cut a piece of skin. We're going to excise this piece of skin and take it out. The other important thing is actually how you use a knife. You never really want to put blunt force on a knife. You want to use it as a sharp blade. You could see we're putting the knife and then just exerting enough pressure. So if we're peeling this orange up, we're going to show you planes of dissection. So you have to retract and be able to expose so that you could see the attachments. And when you see the attachments, you could gently sweep it. We're going to retract further, right up here. Oh. Right there. And then you can peel the orange downward as you go. And so as we retract further, you could see the planes are separating, and then you can cut it and then leave the orange with the peel above. And so by doing this as a practice, you can understand planes using sharp dissection. You could use both the knife and or cautery to do something similar. Let's say you're excising a lipomatous mass following the tissue planes. You need both proper retraction to expose it, so that when you cut the attachments and you're able to leave the tissues fully encapsulated and follow that plane of dissection. So here now we've cut our other line of skin, and so when I lift this up, when we follow down the plane, you could see the plane there, and then we could either push it downward, see? And so when you're pushing it downward, the other hand retracts. So we can do that one, or we can, again, use the knife. So what is the point of the knife? Why not just bluntly dissect everything? The point of a knife, or with cautery, is actually to be able to allow it to be divided at the exact site where you want to take it off. If you exert too much force with blunt dissection, it may tear either under or above. And so if you want to maintain a tissue plane and or hemostasis, you want to cut and burn the vessel specifically while pulling it so that it releases the tissues above from the tissues below, and it is a controlled fashion. Let's do that one more time, understanding it better. So we're going to cut it again down here. There we go. And so we're going to lift this up. You could see that one. You could see the plane there. And as I lift it up, you could point downward. If you point downward with the knife, it would be more towards your orange. Let's say this was a resection of a malignant lesion over the skin. You want to make sure you have a good positive margin. And then so you could go deeper there and maintain a good resection margin. And you could see how I'm just lifting it up. And then the other thing is, you notice the difference between tissue planes, that this is deeper than the other side. And it has to do with where we dissect and how much force you're pulling. It has to do with the retraction on top of the dissection aspect. Now that we've peeled this orange, you could see there's going to be planes in between, and then you can actually dissect them as well. And you can continue to dissect here as I push down. And when you're doing this, this is actually pretty good when you're bluntly dissecting tissue planes for mobilizing your colon, excising lipomas, and it's the same thing, understanding retracting on one hand and dissecting inferiorly. And so there's always going to be two parts of it. So I hope this analogy using an orange to show you tissue planes helps you practice your dissection skills to understand planes better. Understanding that it is a combination of retraction and exposure while following with either blunt or sharp dissection to follow tissue planes. Other things that you can actually utilize are actually spreading with tissue forceps or hemostats. If you're using a hemostat, you put it in here and then spread, and you can see tissue spread. There. You have to be following tissue planes to actually go in. So you can continue to do this and spread it. You can come look at that one. And it has to follow in one plane and not multiple planes. And then you spread it, but you have to resect the areas or incise the areas which are attached so that it doesn't actually break. You have to cut it sharply, especially if there is a vessel. It would be better to coagulate it. So those are the methods that you can perform your resection. I hope you guys liked the video. If you guys have any questions or suggestions, please put them on the comments. Please click the like and subscribe button, and check out the other videos that we have. And I'll see you guys next time.